So we want to welcome everyone that's coming in for our Women's Health and Wellness Making Sense of the COVID-19 Vaccine Series. We're excited that you have all decided to join us, and we hope that you continue to be with us throughout the evening. We want to start off with welcomes from Serena Muhammad, as well as Rebecca Bennett, and following up with Rose Anderson Rice, and then we will discuss who our panelists are.
All right. Thank you, Tracy. So my name is Serena Muhammad. I am the Managing Director of the COVID-19 Regional Response Team. And we've been focusing on vaccine education as a way to make sure that there is a safe space for us to have conversations of importance, for us to get factual information and to find out things that will help us make the best choice for ourselves and our families. We started conducting panel presentations in January. And our goal is to make sure that we're in conversation with community, that we're listening to what the concerns are, and that we're bringing experts together to help us address some of those concerns and answer questions so that we all feel empowered to use our agency to make the choice that's best for ourselves. The regional response team is endeavoring in this particular work in partnership with Prepare STL. And I have my managing director partner, Rebecca Bennett from Prepare STL, to offer some remarks to give some context into the program. So Rebecca, I will turn it over to you.
Thank you so much, partner. Good evening, everyone. We are thrilled and delighted that you have joined us this evening. I do want to say, so many folks are having conversations about vaccination and it's, whether or not to get vaccinated or not. And it seems that somehow the conversation has gotten narrowed to this one intervention. But all of you, like us, have managed to make it through a very difficult year, right? Somehow, with all that's going on, we managed to be here. And I guarantee that we have more concerns and more needs than whether or not to get vaccinated, which is not to say that that conversation is important. It is in fact necessary, but it is not sufficient to speak to the realities that many of us are experiencing, particularly as women, as people who are often the primary earners in our homes, as people who are often the primary caregivers in our homes, as people who are also holding up our workplaces, as people who are also the primary decision makers actively in our families and our communities. We have got so much on our plate, so much on our hearts, so much on our minds, and we wanted to have a panel where we had the kind of expertise and the kind of wisdom that could help us navigate through all of the complexities, or at least many of the complexities of our experience as we live in this era of COVID and seek to do so as healthy as we possibly can and as well as we possibly can. So we are not going to be reductionist this evening. We're going to be comprehensive. We're going to be full throttle, and we're so happy that you're here to join us. So thank you, partner. Thank you, Tracy. Thank you, Serena. And I'm going to turn it over to our Generate Health partners, Rose Anderson Rice.
Good evening. Thank you so much. I am Rose Anderson Rice. I am Deputy Director with Generate Health. And we are so excited to co-host tonight's Women's Health and Wellness panel with Prepare STL and the Regional Response Team. Generate Health's mission is to inspire the region to advance racial equity in pregnancy outcomes, in family well-being, and in community health. And I want to welcome you tonight to this event. It is going to be very informative, and I know it's going to be very engaging. So please engage in the chat, and let's just have a great discussion. Thank you so much.
Thank you so much for giving us all of this information. We are so excited about everything that is about to happen tonight. We just want you all to know that if you have any questions, you can continue to give us some Q&A. We have a few questions already that have come in. But look, grab your coffee, your tea, your STL water, or whatever you have in your cup, and let's just love on ourselves and take some notes so that we can get this information out to the community. But it starts with us first, so we're glad that you're here. So now we'll jump right into some of our amazing panelists, and I want to just let you know a little bit about each and then we'll start with opening remarks. We have Leslie Gill. She is the president of Rung for Women. We have Brittany True Kelman, always known as True, as the founder of Jamal's Birth Village, and she also serves as the executive director and lead midwife, as well as Shavana Spratt. She is the podcast host of The Hood Talks, you know, where communication voice is first, as well as she's the owner of The Hood Doula, and she is also serving on the Ferguson Human Rights Commission. And we will definitely have with us, she's here, Dr. Ebony Carter, assistant professor in Division of Maternal Fetal Medicine, Chief Division of Clinical Research for the Department of Obstetrics and Gynecology with Washington University of Medicine in St. Louis. So as you can see, we will be well informed, as well as myself. I'm a licensed therapist with Imani Therapy, practicing for women and girls. So we're going to take a few minutes, 5 minutes per panelist, to just give some opening remarks, and then we will go through some of the questions. So hopefully you all are clear and you're ready to listen and be engaged and be informed. So we will start off with Leslie Gill.
Thank you, Tracy. Good evening, everyone. And thank you to all of our hosts and sponsors for this evening. I'm super excited to join you to talk a little bit about COVID and women and how 2020 is over, thank goodness. And we are looking forward to 2021. And in this Women's History Month, almost the last day of Women's History Month, I'd like to just share a little bit about how Rung for Women is making her story happen. And so, you know, our mission is really to help women ensure that they know that they have the power to transform their lives. And so we, about a year ago, opened a women's center in the Fox Park neighborhood in the city of St. Louis. And so next slide, please. And so we are a place for women to come and elevate their life and their careers. We offer co-located and coordinated services, a one-stop shop for all things women, all things goals, all things elevate your life, change your life, build community. And so I'm really excited to share that our first cohort of women started this month. So we made history this month in Women's History Month by starting with our first cohort of women. Next slide. Oh, and I see we have a Rung member on. So thank you, thank you, thank you. And so our Rung members started their journey, and you know, the reason why Rung is so important is because we know that women often live in poverty more so than men. We know that there are significant female-led households in the St. Louis region. We know that 56% of the job losses during the pandemic fell on the backs of women. And we know that some of the industries hardest hit, service industry, hospitality, entrepreneurs, were primarily women-owned businesses. And this is the statistic that just is heartbreaking for me, that in December of 2020, there were 140,000 jobs lost across the country. And all of them were women. And so this pandemic has been catastrophic for women. We found ourselves, as mentioned earlier, being sandwiched between parenting and working, and you know, trying to do the best we could with what we had. And often that left us tired and exhausted, or even more tired and even more exhausted. And so Rung was really designed to be a community to elevate women and to really help you achieve goals that you never thought you could. Next slide, please. So who is a Rung woman? We have 118-ish women who started on this journey just a couple of weeks ago. And so, you know, minimum age 21, personal income of $50,000 or less, high school diploma or equivalent, 6 months of stable housing, and ability to get to our Women's Center in South City. And so you will notice that especially the income criteria is relatively high, but we recognize that often women are surviving and not thriving in households where, you know, the income might be decent, but it's really not enough to get ahead. So our goal ultimately is to get more women to make more money and to move into career pathways that pay a family sustaining wage. Next slide. So we're making her story, as I mentioned. We're super excited that we welcomed our first cohort, and they all started in March, a couple weeks ago. March is almost over. So March 12th was the first welcome weekend. And we know that Rung is necessary. We had about 900, just under 1,000 applicants for 120 slots. And so we will have a second cohort this year because, again, we know that our services and the community and the idea around helping women elevate their personal and professional lives is even more necessary now in this pandemic and even post-pandemic and recovery. So we're excited to be in the community, serving women specifically, and a space where you can come and grow and bring your children, get healthy food, commit to a healthy lifestyle. So there's everything from yoga and mindfulness to an on-site medical center. So next slide. There you see a picture of our beautiful campus. So we grow food on site and we provide daily grab and go meals for our members, prepared by our wonderful on-site chef. We have a gym and fitness center. We have personal training, yoga, mindfulness, and on-site medical center. And then coaching. All of our members are matched with a coach. And the coach is really the member's accountability partner, helping them achieve their personal and professional goals. Next slide. So I will just say that if you're interested in learning more about Rung, there are opportunities to volunteer. There are opportunities to become a member. Next slide. No, I didn't realize this. Yeah. So lots of volunteer opportunities, lots of opportunities to become a member. I think that should be on the next slide. Yep, there you have it. So you can volunteer or email. You can go on our website and sign up to become a volunteer, or email volunteer@Rung4Women. Same to become a member. Member@rung4women.org, or you can go to our rung4women.org website, and the membership application is on our landing page. It's a rolling application, and like I said, we will welcome our second cohort later this year. Next slide. Other ways to help, you can, I mentioned this already, but you can refer a member, you can become a member, you can connect us to your employer. If you have an employer that's doing great and amazing things and should be part of our community, we certainly want to hear from them. We are always accepting financial gifts, and that is how we make our work happen. And I think this is my final slide, which gives my information. Yes, there you have it. So thank you. I'm excited to answer questions and hear from the rest of the panelists. Thank you, Tracy.
Thank you, Leslie. I love Rung, everything that it represents. It's all about women thriving. As you all can see, we have some really inspiring, powerful women a part of the panel. Next up, we will have True.
Good evening, everyone. Super happy to be here. Let's see, make sure it's showing up fine, good. So my name is Brittany True Kelman. I go by True, and I'm founding director of Jama Birth Village. And I am also a certified doula and a certified doula trainer. I operate BTK Consulting Firm, which is a maternal health consulting firm that assists both community members as well as hospitalists and clinicians into weaving culturally congruent care into their maternal health practices. I am a Texas native, a Black and Indigenous woman. And so I really bring both sides of my African and Native ancestry into the line of work that we do from a very rooted cultural and spiritual perspective. I want to share just a little bit about Jama Birth Village and some of the work that we do in the community. Our mission at Jama Birth Village is to provide affordable access to midwives and doulas of color and childbirth and parenting education in the St. Louis region to lower prematurity, maternal and infant morbidity and mortality through a network of health professionals and peers. So we really work very hard to shine a light on some of the different complexities that impact Black pregnant bodies. And so my expertise is in holistic wellness. So as a certified professional midwife, I practice in the community, and we utilize holistic modalities to really support and strengthen the bodies of pregnant people and their families that they care for. So at Jama, we offer both pro bono and sliding scale midwifery and doula care options. And so we answered a big, huge call in the community by making sure that we have access to Black and Indigenous birth workers of color. And so we've been doing that since 2015. And since 2015, we've trained over 150 doulas. And just recently this year, Jama was awarded with the opportunity to work with our partners at Generate Health through the Safer Childbirth City Initiative, which works to train an additional 360 doulas of color across the St. Louis region. And so this is all in an effort to make sure that every community and every zip code that is in the urban core of St. Louis can have the type of care that they want, need, and deserve, and to make sure that income, zip code, and other barriers that Black people tend to face, we want to make sure that that does not get in the way. So as well as providing midwifery and doula care services at Jama Birth Village, we also provide robust social support services. And so we have access to a mental health counselor on staff. And I would love to talk about that a little bit today and how COVID has impacted the mental and emotional well-being of pregnant and parenting people. But all of our clients have access to see our mental health counselor at no cost. We have a herbal apothecary at Jama Birth Village, which provides healthy and organic supplements and vitamins and ethically wild-crafted herbs to help to support a healthy body in the perinatal period. We also have access to lactation specialists, childbirth education, a mother-baby closet, and a seasonal community garden. So we're really, really happy and honored to be able to provide this work in the community. We have a team of over 11 providers and a robust community of volunteers. And so doing this work is getting us closer to a zero racial disparity when it comes to maternal health. But also, besides just focusing on the mortality aspect, we're also helping to inform, educate, and equip pregnant women and their families with information prior to birth to avoid morbidity, which is harm, to a pregnant person's body that can last, in the first year postpartum throughout the rest of their lives. So really happy to be able to share some insight and some wisdom from the village, and just as my perspective as a provider. And so I welcome any questions or thoughts as we go along this evening.
Thank you so much, True. Oh my goodness, you truly are the village. Like she said, it's all about informing, educating, and equipping. And we have the resources here, so we have to spread this information with everyone. Thank you so much. Again, I'm looking forward to the questions that are coming in. Also, please remember, if you need to have like private chat conversations to a specific host, you can definitely do that through the chat, but we are also looking at the Q&As as well. Next, we will bring up Shavonna Spratt.
Well, good evening, everyone. I am definitely excited to be here and definitely honored. My name is Shavonna Spratt. I am a mom of two beautiful daughters. One is 3 and one is 9 months old. A resident of Ferguson, Missouri. I am the creator and host of the new podcast called the Hood Talks Podcast. We recently launched in December. I call it a community podcast because it is a podcast that is centered around community, empowerment, and providing voice to the voiceless. We have a mission to engage the community, educate the community, and be a resource to the community. I created this platform because I know how important it is for the people living in the community to be the voice of those communities. So often, the people sitting at the table making decisions are not the ones who the decisions affect. So I say we need more community people at the tables making decisions. And I also know, if anything, educate yourself and on things happening in your community. Be demanding of your local leaders and elected officials about what your community needs, whatever that may be. My focus today around the vaccine is we all have heard it. I know I have in my community several times, is that people just don't trust the vaccine, which is a valid and understandable looking at our history and looking at what's happening today. So instead of making the vaccine the only solution, which appears to be a temporary solution with unknown ending results, can we focus more on providing the sustainable solutions that my community has been demanding for generations? What are those, you ask? Community talks about systematic racism that is affecting us. We talk about lack of economic development in our community, access to affordable and quality healthy foods, access to better healthcare, and also just the lack of access to resources that can meet someone's basic need as a human, which, when not addressed, often leads to the development of chronic health conditions that has been what, again, is causing my community to be more impacted by COVID. And as for women wellness, we need to be, and I say we, because as a mother, I understand, we need to be more intentional about how we are taking care of ourselves. First, physically, taking care of ourselves first. That's physically, mentally, emotionally, and spiritually. Ladies, get you a therapist. Get in that self-care, sis. And then take care of your families and your community.
Thank you. Thank you. I want to say Vanna, because I feel like she's like family now. You know that.
Yes, you can call me Vanna. That's fine. That is totally fine.
Thank you for sharing. You all need to make sure that you continue to share this information. When I think of Vanna, I think of the village. You know, they say WIN is women in the neighborhood. And she said that community's voice is first, and that's what's most important. So thank you. And let's continue with Dr. Ebony Carter.
Good evening, everyone. And Tracy, are you able to see my slides okay?
Yes, we are.
Okay, excellent. So good evening. Thank you so much for having me. I have really enjoyed hearing my fellow panelists. And I wanted to spend a few minutes talking about the vaccine because there's been a lot of fear and trepidation surrounding it. And for good reason, because there's a history of past and present wrongs that give us every right to approach the vaccine with some concern. In the spirit of full transparency, I had it too, but knowledge is power. So in the next few minutes, I want to share some information about the vaccines and how they work. And this is my obligatory wash you slide. So here's a picture of the coronavirus, which you see right here. And there are 3 types of vaccines that have been developed. And I'm just going to focus on the last 2 that are available here. So this number 2 is the Johnson & Johnson. Number 3 is the mRNA, and that's the Moderna and the Pfizer. So now before I get too far into that, let's address the elephant in the room. So we all know that it usually takes years to develop a vaccine. So how in the heck did they develop these vaccines in less than 12 months? And the answer is they really didn't. The coronavirus actually is a family of viruses. And before there was COVID-19, you might have heard of SARS back in 2003 or MERS in 2012. They're all in that same family of coronaviruses, and they're closely related. So back in 2003, when SARS came along and we were afraid that it was going to be a pandemic like the one that we're in now, scientists got to work trying to create coronavirus vaccines to fight them. But luckily, neither of those other ones actually raged out of control into a pandemic. And so there just wasn't the money or the willpower or people volunteering to be in trials. And so they just kind of, that technology just kind of sat on a shelf until January of 2020, when we realized that COVID-19 might be the real deal. And scientists picked up right where they left off in 2003 and 2012. And that's why we have these vaccines in record time. But let's be clear that the vaccine that got us here started years ago. So it's kind of not what it's really appeared. So back to my slide and the types of vaccines, all of them take advantage of the fact that if you see this is the coronavirus gets its name from the Latin word crown. And crown, you look at it, it looks kind of like a crown of thorns here. And so this is called the spike, and you see it here. And the spike is the nasty part of the virus that essentially attacks our cells, invades our bodies, and that's really the bad actor. And all of the vaccines exploit this fact of the spike, okay? And if people have questions, please put them in the chat. I am happy to answer them. So all of the vaccines essentially work by getting this spike into our body so that we can see it as a foreign body that we need to attack, and we get the spike and don't get this whole nasty virus. So the thing is, the mRNA vaccines don't make a whole lot of sense. They're new, people don't really know a lot about them. And so I actually want to spend a little bit of time with a cartoon that explains how the mRNA vaccines work. So this is an illustration of the coronavirus. It's magnified thousands of times. And remember back to my last slide, these little red thorns in the crown are the spikes that I spoke about before. And those are the virus's key weapon. So early last January, scientists from China published the genetic code for the virus on the internet so that folks from around the world could actually start working on it. So you see these little white squiggles here, they represent the genetic information for the virus. So scientists basically copied a tiny part of it that's responsible for making that spike protein I've been talking about. The other term that you've heard for the little piece of genetic material that they used is mRNA, which stands for messenger RNA. I like to think of the mRNA vaccine like a fortune cookie. So you have the fortune cookie, and then inside of it, there is a little fortune, the mRNA, and it tells your body, make that spike protein. But mRNA is fragile, and it gets broken down really quickly. And so that's why it needs to be wrapped in a ball of fat, or my fortune cookie, so that it can last long enough to get injected in our bodies, get into our cells, and tell it the message, go ahead and start making those spike proteins. The vaccine, or my fortune cookie, is injected into our muscle, and it delivers the message to our cells to make the spike protein. And then we generate an immune response. So antibodies are the little soldiers in our body, and they mount in number, and they go off and they are ready to fight the coronavirus because our body now recognizes these little spikes without ever having to see that entire nasty coronavirus. And that's essentially how the mRNA vaccine works. So that's the Moderna and the Pfizer. Now for Johnson & Johnson, which has come along a little bit later, you can think of it the same way I have here with my fortune cookie, but rather than using a layer of fat to wrap the mRNA, they actually use the cold virus. So think of the shell now, rather than being a ball of fat, as the cold virus, but it's dead, it's inactivated. It actually can't infect you, it can't do anything. It's really just a delivery mechanism to get DNA that says make the spike protein into your body. And they use this for Ebola. There was an Ebola vaccine that used that same type of technology from a cold virus. So the thing is about the J&J, I think it's kind of gotten a bad rap because people are like, oh, it's not as effective. But there's only one shot, which is a huge benefit. And the reason for that is when they did the trials for vaccines, the Johnson & Johnson vaccine was actually highly effective after one shot. The mRNA vaccines, after one shot, you still needed a little bit more. And so that's why that one gets 2 and the J&J only gets 1. So I feel like J&J is kind of getting a bad name unfairly because it worked so well, it only needed 1. So that's my first point about it. I'll make my second point in my next slide. So the reason why there was so much excitement about mRNA vaccines when they first came out last, fall, late fall, early winter, is because the effectiveness data was so much better than we could have ever hoped for. So this graph represents the first time that you get shot number 1, and so the red represents people who got a fake shot, nothing in it, and the blue represents people who got the actual vaccine. And what you see is that starting around, 8 days or so after you get the vaccine, what happens to people who got the fake shot? Their coronavirus numbers, they take off. And people who got the real shot, what happens? It levels off. And so both the Pfizer and Moderna vaccines were 95% effective in helping people to not get the coronavirus. I remember Dr. Fauci saying early in the pandemic, if we got a vaccine that was 70% effective, like that would be great. We would call it a win. 95% is really hitting it out the park. And I will admit that it wasn't until I saw this graph that I started to get excited. Now, going back to my J&J example with the Johnson & Johnson, people were like, oh, it's only 70% effective. Give me the other ones. I want that. Well, the thing is, what you actually care about is not really getting the coronavirus, right? We get viruses all the time, like the cold. It's not a big deal. You get some sniffles, you get over it in a couple of days. What we care about is death and hospitalization. And when you use that metric, Johnson & Johnson is 100% effective, just like the Moderna and Pfizer are. So yeah, maybe you get some sniffles because maybe you get the virus, but you don't die and you don't get hospitalized. And so, you can see, I think the J&J is just as good as the other ones. So I'm an obstetrician. I am happy to talk about the pregnancy implications, but I wanted to start with that, give an overview, and in respect for the rest of the panel and time, I'm going to stop there, and I'd be happy to answer pregnancy related questions later. Thank you so much.
Thank you, Dr. Carter. That information was so informative. I'm telling you right now, I was talking to someone earlier about this conversation, and they were like, I don't know if I should get the shot. I don't know if I shouldn't. I don't even want to talk about it because I don't want to be shamed either way. And I was like, no one's going to shame you, but you do need to be in the space to listen so that you can be informed. And I think that that's what this is all about, us really being informed. So for the sake of time, we want to start on time and end on time. If you guys have questions, please, this is the time you can put them in the chat, and we will make sure that all of our panelists are ready. So we have a few questions, and let's get this started, okay? So one of the questions definitely that came in is a question about pregnancy, and it says, why are organizations saying that the vaccine is safe for pregnant and lactating mothers when clinical trials have not been completed on these populations? I've been cautioned on everything from everyday medications to medical treatments. So being told that this is okay without clinical data is confusion and frustrating when I'm trying to be safe. Dr. Carter?
That is an excellent question. It is completely fair because pregnant and lactating people were systematically excluded from all of the trials. So it's a good question. I will say, as a high-risk obstetrician, I have seen COVID up close and personal. And so the things that worry us about COVID during pregnancy is it's more severe. So if you are pregnant and you get infected with COVID, your risk of ending up in the intensive care unit is increased 3 times. Your risk of having a machine that has to breathe for you increased 3 times. Your risk of death is increased twice. And so I don't want to scare people because the absolute numbers, like that's not going to happen to most pregnant people who get COVID. So no need to be terrified, but the risks are significantly higher if you're pregnant. So we know that. In terms of the vaccine, pregnant women were excluded, but there's no reason to think that pregnant women would have any less of an effect in terms of the effectiveness than non-pregnant patients, number one. Number two, what are the potential risks of the vaccine, theoretically? So with the mRNA, I told you it's super fragile. Like that's why you need a second shot of it. That's why they had to figure out how to wrap it up in fat. In a lot of studies, the mRNA is gone within 5 hours. So the likelihood that that mRNA is going to get over, through the placenta to the baby to cause any impact is exceedingly low. And can I say with confidence? I want to be completely honest. Pregnant women weren't in the trial, so I can't say it. But really the risk benefit that we're weighing is the risk of getting COVID. And I know what COVID does in pregnancy. It's nothing nice. It's horrible. I've seen people who were healthy on a Friday and it's death's door in the ICU on a Wednesday. Versus the theoretical risk of the vaccine, which are actually very low. Like that's really what I'm weighing as a high risk obstetrician. And so in my opinion, the risk of COVID are significantly greater than the risk of the vaccine. But in the absence of data, I'm telling all of my patients, it is a completely personal decision. There is no judgment. It is perfectly reasonable to say, we weren't in the trial, so I will wait, thank you very much. But it's all about balancing risk and benefits. It's not a matter of like, getting the vaccine or not. The choices are actually how do each of us exit this pandemic? The choices are COVID or vaccine. And I think the risk of the vaccine are likely lower.
Thank you for that and your transparency. We have a few more questions for the other panelists, but I want to ask this question when it comes to fertility. They stated, I have had questions about potential effects on females, but what about the male fertility as well? Females and males from clients who are planning to have children.
Oh, here, I'm unmuted. That's actually a really good question. And if it's okay with you, I'm going to share my slides because I feel like this will illustrate it better. So there has been no evidence that the vaccine causes infertility for women or for men, number one. And give me a second just to share really quick. Okay, can you see my screen? Okay, great. So the fertility myth that's out there for women is essentially put out by these guys, and they published this blog back in October, and they said in the blog that there is a protein in the placenta. That's the organ that gets nourishment from mommy over to baby. And they said there's a protein in the placenta that looks like that spike protein that I kept showing you before. So they were arguing that if you take the vaccine, that then the vaccine is going to attack your placenta and cause fertility issues and miscarriage and all that kind of stuff. So I wanted to show you a picture here. This is the spike protein as a cartoon. And then this is the placental protein. So even, this is not what I do for a living necessarily, right? I can look at this and say that these are not the same. And so confusing the vaccine, confusing the spike protein for the placenta protein is like me confusing Donald Duck for Mickey Mouse because they're both cartoons. They look nothing alike. And so this one blog has fueled so much fear and angst and like, I want to start a family. I'm scared to get the vaccine. What's it going to do to my baby or my fertility? And I can definitely say that this is false, like the basis behind it is false. So within the realm of what we know, and like I said, we're still learning a lot, there's really not a concern for male or female infertility as a result of the vaccine.
Thank you. So this question is for Leslie. I know that many of our communities and families are primary earners and caregivers and decision makers. But what are some of the issues that are being heavily discussed by the women that you serve as we mark this 1-year anniversary for COVID?
Oh, that's actually a really great question. So we are hearing lots of stress from homeschooling. from, moms who are having to make the choice between staying home and homeschooling or going to work, particularly for those industries where, working from home is not an option. So lots of stress and trauma around making those decisions. Also, just the loneliness that has come as a result of being in a pandemic and being quarantined or isolated from friends and family. So, think about holidays and birthdays and family gatherings that people missed, women in particular missed over the course of the year. So, just lots of loneliness. And so, Rung is so committed to community, and we're excited that we're able to bring small groups of women together to start to repair some of that harm that has been caused as a result of the pandemic, and really start the healing process. And so I would say parenting, homeschooling, and being isolated from family and loved ones, particularly parents and aging parents who you haven't been able to see or hug or touch over the course of the year.
Thank you. Thank you for that. Shavana, you want to add to that? I was downloading Spotify for your podcast, and I realized that this is an ongoing conversation for our women. We suffer in silence. We wear the cape. Can you speak to some of the issues or concerns that you're hearing out in the community?
Yes, unfortunately, I cannot undo my video, but for me, I think it's been a lot of mental stress, having to, deal with being alone, childcare. And I'm not just talking about childcare for a job or to go to school. These women are mentally drained. They're at home all day with their children. They can't find the time to do things that can be beneficial for themselves. So finding that, I know a lot of women talk about having that support system and not even being able to tap into the ones they do have because of COVID, because it might be like older adults or family members that they're counting on that they don't want to, bring COVID to, or things like that. And then just access to things, like even if there is some program like that, Wrong Woman sounds like a great program, but look at the location, not to shade anybody, but it's far and a lot of people can't drive. So the transportation to get to those places is really limited. And things that's going on in the neighborhoods and community events is really limited, especially now because of COVID. So that's what I'm hearing.
Thank you. You're absolutely right. Transportation is definitely an issue. True, you spoke to the value of us making sure we take care of our mental health and the wraparound resources that you offer. Talk to us about those supports and how important they are, and if there are other resources out here. I know Southside offers resources, but can you speak to more resources and how we can find them?
Yes, and I've heard quite a few of the same things that Vanna has shared, that she has also experienced, hearing from some of our people in the community. And mostly, yes, a lot of our women are pregnant people are also stressed about how is the pandemic going to have an effect on their pregnancy and their birth and their babies. And so we're having to see women and pregnant people work 2 to 3 times harder. They're having to piece together, money like never before. They're also, as Vanna mentioned, having to educate their children. We have food shortages and access to food, issues with access to food that have really exacerbated the prior social determinant of health issues where we were already living in food deserts. So, at the height of the pandemic, a lot of people were not able to get to grocery stores or go to grocery stores within a certain amount of time. So people shifted and they became comfortable eating food that maybe did not benefit their overall health and wellness. So then it's causing mental fatigue and physical fatigue because they're eating, foods that are not a high in nutrient value. And so the self-guilt comes in. As well, there is increased technology and screen time and less human to human authentic time, because I know that a lot of us have maybe went to, to see a loved one, or you may in passing by see someone, and you want to go to hug them, and then you do the drawback. Right. So it is increasingly lonely. And so we have seen a number of women with drained hormone loads, and a number of pregnant people. We need certain healthy hormone capacity in order to have efficient, non-complicated labors. So midwives across the nation have reported a lot of different challenges because of the impacts of the pandemic, essentially, on the mental health and well-being of the bodies of pregnant people and women. So what I want to share, what we have done in response to that, we don't want to wait until someone's having a mental health care crisis to connect them with a mental health care counselor. So from the moment that they enter into a consultation with us, we are doing something called an Edinburgh postnatal depression screening or scale. And I don't like the word postnatal. I hope they eventually change it to perinatal, which encompasses all of pregnancy. But essentially, we're checking on your mental, emotional health initially. And even if you score low, and you can take this screening yourself if you're a perinatal person or postpartum person. But even if you score low, we're connecting you with a mental health counselor so that you can create a mental and emotional health care plan. So you can create a spiritual and, a physical health care plan. So we also host a virtual mom support group weekly. It's free. You get free diapers when you attend. We often give you gift cards. So like in February, every week that someone came, you got a gift card to go get yourself a self-care item. So, and outside of those focused mental health care components, what I love about midwifery care is that we're spending mostly an hour with me, because I love talking to my clients, but we spend about 45 minutes to an hour in each visit. And we're not just checking weight, blood pressure, and fetal growth and development. We're talking about it all. Your emotional life. Has your intimate life been impacted? We're also building unique individual nutrition plans that can help to boost the proper, chemical components and hormones in our bodies that we need to grow a healthy baby. So all in all, as Shavana said, and as I'm pretty sure a lot of us are recommending on this panel, please make sure to look into what mental health care services are available to you. There is no shame or judgment in that. You want to make sure that you're at your optimal best for your family. If you need help, you can reach out to Jamal Birth Village, and we can help you to receive those services and support options.
Thank you. Thank you. And also, just in regards to the resources, I see that Kelly Moore stated, thanks for all the information. It's extremely helpful. Can anyone on the panel suggest therapy programs that offer a sliding scale? Definitely check also with Prepare STL's website, Regional Response Team, and Generate Health. I know as a therapist here at Imani Therapy, we also serve teen girls, and they too are struggling with anxiety, not being able to, the social isolation. Girls are very social. And so we partner with, we have sponsorship with the Boris Henson Foundation that Taraji P. Henson started. And we offer free teen support circles. We actually started a 6-week one tonight, and it's absolutely free. But they also offer therapy to different states, specifically to Missouri. So if you go to their site, they will give you resources. We have to continue to spread this information. Let's go to the next question. Let's see, it says, I have been exposed to the virus multiple times, but never had the symptoms and tested negative twice. Why do I need the vaccine if I'm not vulnerable to it since I've been exposed repeatedly? Dr. Carter, you want to answer to?
I'd be happy to answer that. So there are a lot of things circulating about the vaccine. And one of them is that you get better immunity if you actually get it. So it's like, I'll just go ahead and get the virus because I have better immunity. And that one actually isn't true. So if people have, in particular, like either asymptomatic infection, so no symptoms, or mild symptoms, we actually have pretty good data that the vaccine gives much better protection. And so, you know, in my opinion, given that there are new variants circulating that may be more severe, that may be easier to get, I would just be like, thank you, God, I didn't get sick the first 2 times. But I would want that vaccine protection. So that would be my suggestion.
Thank you. Thank you. And Leslie, I know that the co-designers, one of your co-designers, you offer resources within RUNG when it comes to having the clinic where they're inside and out. We talk about the mental health services and the things that you can do, from yoga to different aspects, even though the things are specific to the members, your co-designers are out in the community as well, correct?
Absolutely. So we have 9 organizations co-located at our space. And so the Collective STL provides yoga and mindfulness at their yoga studio in Old North. Provident, Safe Connections, 2 of our mental health providers, both offer sliding fee scales and are community-based. And so unfortunately, I don't have them handy, but they each have 800 numbers and 24/7 support. Family Care Health Center is our medical provider. Dr. Kanika Turner is our physician on site, and she also is located at the location in far south, so Holly Hills, at their location in Holly Hills, but they also have a location in the Grove on Manchester. Yes, so all of our co-design agencies, RUNG is just a satellite location, and they all offer services outside of our building. Urban Harvest STL has a variety of farms and gardens throughout the region, so certainly can get fresh and healthy food from Urban Harvest.
Awesome, awesome. I noticed that we are very active in the chat as well. Emily stated that Nurses for Newborns also offers support during pregnancy and postpartum periods. So definitely check with those resources there. Yes, the Collective STL is a good option also. I'm looking at more questions that are coming through, but I wanted to find out, someone stated, Dr. Carter, what do you say to those patients who've already had COVID? She talked to that. Do you think the vaccine is going to be a yearly thing? As a nurse, I'm concerned about the short-term immunity and encouraging and teaching the community the need for vaccine. And this will be potentially a virus that's going to be seen as common as the flu.
Yeah, I would totally agree with that. And I'm trying to be very clear about like where we know stuff and where we don't know stuff. And so I think that the answer to that question is, honestly, I don't know. The people who got the Pfizer and Moderna vaccines, they're only a few months ahead of us on this journey. And so they're going to continue to follow those people, see when immunity starts to wane and when they probably need a booster. So, you know, my educated guess on this is that, yeah, I think coronavirus is probably going to end up being like the flu vaccine, where every so often, is that 12 months? Is it 18 months? We don't know yet. We're probably going to need to get boosters as the virus continues to evolve and those kinds of things. But honest answer, I'm not sure.
Okay. And one more question in regards to what it looks like for resources. Louise says, I'm allergic to all of the medications. So my concern is that I was advised by the Madison Health Department that I needed to be vaccinated in a hospital and be monitored. Thus far, no one has been able to help me. I've contacted local hospitals and no luck. Do you know of any hospitals that are going to vaccinate and monitor people like me that cannot go to a mass vaccine site? Or are there any clinical trials or anything out there?
Okay, so that's an excellent question, and I can try to help with that offline afterwards. But yes, so people who've had allergic reactions, there really aren't very many people who can't get the vaccine, because especially for mRNA, it's a pretty clean vaccine. There's not a lot of other stuff in it. So unless you've had like actual anaphylaxis, like serious allergic reactions to a vaccine in the past, most people can get it fine. For people who've had allergies, we do recommend, you know, most of us are going to get monitored for 15 minutes after getting the vaccine and have to, like, you know, budget the time, wait there. For people who've had anaphylaxis, it's a 30-minute waiting period. And so I know that at the Barnes vaccine facility, like they had that set up. So anyway, I'd be happy to help afterwards offline.
Great. Someone else said there's a website. Emily said Start Here STL. And the Imani Therapy, I just want to give you all talk to about the I Define Me movement. We have a wellness mobile where we're trying to put a lot of different resources out in the community. And I definitely speak to our teen girls because they're really being advocates for the issues. When we talk about our women defining their voices, our girls need to define their voices as well. So when you see that wellness mobile out there, we're offering resources that we can give to the community, as well as social emotional learning, everybody getting those journals and connecting, because that's how this works. I'd like to talk about, there was a question, and I want to offer this to all of our panelists. If we were to put forth a women's agenda that focused on public investment and action in response to this ongoing crisis, what would the top priorities be for you, and what should we champion with them? Let's start with True.
I was just getting ready to hit unmute. So you're on point, Tracy. Okay, first thought that came to my mind is doulas. So of course, we have a small team of staff doulas and we train doulas, but the affordability of doulas need to be expanded, especially postpartum doulas, because a lot of families are having to work. So, try to work as much as they can to bring money in during the pandemic. I have seen repeatedly a lot of new mothers and new postpartum people left home alone, stressed out, not eating well, not getting enough sleep, with a slow mental emotional health decline. So if we have doulas in the homes who look like the people that they're serving, we can catch medical complications earlier and make sure that they're working with their provider, and also help to keep them nutritionally and emotionally supported while getting hands-on assistance with breastfeeding, newborn navigation, and other support options. So Jama does provide pro bono and slide and scale doula care services in the community. So I'll drop our website. You can book a consult before starting services, and we'll let you know more about what we have.
Please drop it.
Thank you.
I like that she said you can get a consult, and they're doing those assessments. So many times people just go right in and they don't ask the key questions because someone told them to go. But make sure that you ask those questions, create a list, and utilize the resources that are here, especially when it's culturally relevant to you and the resources that we have. Shavana, Bana.
I think I second what True said. I'm very much an advocate for doulas. We just actually did a show about doulas and what they do on the Hood Talks podcast. But I would also say mental health. I think that is very important when it comes to women, because again, like Ms. Rebecca said, we wear so many hats, and it's our nature to want to put everyone first, but we don't do it for self. So definitely mental health around women's wellness, period, in pregnancy, after pregnancy, and all of the things in that nature. And also, speaking to some folks before this, they talked about just having access to resources, period, in the community, making them more available in their communities and more easy to get to, and then also affordable and quality childcare services. So.
Yes, when you talk about affordability, that is crucial, as well as you brought up a huge point. Transportation is an issue.
Yes.
I tell you, the one thing that this pandemic has benefited us from is telehealth. There's a lot of health resources out here. One of the things that we started offering to our teen girls was that if they were a part of our program and they wanted to receive the telehealth, that we will offer them free tablets and cards so they could have the safe, I can't think what you call it, the spot. What do you call those things?
Hotspot.
Hotspot. And so we offer them a tablet with a hotspot, with a cash card, so that they could utilize it for their sessions. And they were very comfortable with that, as well as women. We cannot continue to suffer in silence. And we know the child abuse numbers, domestic violence numbers, all those things are going up. And so we need to be able to continue to provide resources to one another.
And one thing that you did mention was the groups, the mom support groups. I think that is definitely beneficial as a mom and have attended those groups. Finding other people to tap into, unfortunately, virtually with COVID, it's still as beneficial as being in person, because some days you just don't feel like you have anybody. And so having that is very, very beneficial. And I think that'll be something too else to help tap into.
Thank you. Thank you. Leslie.
Yeah, to not repeat what others have said, and I totally agree with all of the other recommendations, I would add reskilling to the list of priorities. As we know, job loss has impacted women significantly. And so creating new opportunities for new career pathways, that offer flexibility and work from home options, and training and education to reskill to move into these new career pathways would be, I think, an item that would certainly be on our list. And workplace policies that are family friendly and woman friendly. So leave policies, flexible policies. The Women's Foundation of Greater St. Louis just announced their scorecard of organizations and companies that are the best places to work for women. And so I would say, adding to that list and getting all of our local employers and regional employers on that list should be a priority, while also finding new opportunities and career pathways for women to move into post-pandemic.
Thank you. Thank you. I'm looking in the chat, and there's so many different, there's a lot of feedback about resources. Neva gave another resource, the crisis counseling program that FEMA and other local providers have funded. But Shamim also talked about the struggle of homeschooling, like that. All the parents were shouting out the teachers because we didn't realize the struggle is real, especially when you don't have the resources for all the different hot spots, right, True, as well as the knowledge and trying to manage all of those things. One of the resources that we've offered is a university, an online university for girls to tap into, to focus on. I keep saying social emotional learning because it's something that's needed throughout school. And then the outside care of being able to have a safe space to just be able to play and walk and talk. Dr. Carter, what are some areas that you're seeing that we need to champion?
So I wholeheartedly endorse the beautiful list that's already been given. In addition to that, especially like the paid doula services, it angers me that we think that doulas should just volunteer their time for free. It's hard work. We should be paying people for it. So that's at the top of my list. Paid parental leave. Having a child should not be an economic catastrophe for a woman. And I will also add to this, and it's not the whole solution, but I feel like it's significant, universal healthcare. So healthcare is a right, it's not a privilege. Now that's a tall order. So I would settle for Medicaid expansion, but I'm a high-risk obstetrician. By the time a patient with a lot of medical problems comes to me in her first trimester of pregnancy, I hate to say it this way, but it's often too late for a lot of the things that we could have done to try to prevent things. Like good pregnancy outcomes happen before you ever get pregnant. And a lot of patients, especially in St. Louis that I care for, have no access to those resources before getting pregnant. So universal healthcare, I will add to the list.
Universal healthcare, absolutely. Serena stated that any tips on how to help friends who are coping with stress and grief. I know that we have all started like just checking in with people. Literally, everybody was always texting, and now picking up the phone and calling or being able to, even when it comes to our neighbors, oftentimes I say, we knew our dogs, we knew the people's cars, but do you actually know your neighbors? Are you actually checking in on your loved ones? Like, no, not just are you okay? I need to see your face, or some other resources. But True, let's speak about that again. We talked about simply saying you should see a therapist isn't the right start, but you talk a lot about prevention, intervention, and awareness. Let's speak to that.
Yes, and so from a preventative perspective, it really sheds some light on understanding your personality type, as well as understanding what your work-life balance is if you are a person who works outside of the home. And, you know, whenever you're practicing preventative emotional mental health, you're really kind of looking at how much are you pouring out versus how much you're getting in, you know, and we helped our clients and our families to really create a collective care model versus self-care. Like self-care, I don't want to say it's played out, but it really is it hitting home for some people, because at first it was bubble baths and candles, and now it's like self-care is mental health care. But if you go to a counselor and there's a lot of work that you need to do, if you don't have the proper support because you're isolated or people aren't checking in or you feel judged, then you're not able to apply the self-care properly. So our collective care framework really helps to empower women to get out of that fear of feeling weak or vulnerable, or I don't want to ask for help, and to identify trusted people who can, you know, support them in different ways, and where they can delegate different chores or, you know, different tasks. Teaching and training people on how to support and love you. And something, because we are talking about women's health and wellness, even thinking about our monthly menstrual cycle or moon time, you know, we're expected to work, cook, and clean like if we're not having a cycle. So also like retraining the people who live in your home or around you that when it's that time for you, that your chores or your responsibilities should be lessened, and you should be able to have collective care and delegation so that you can have your hormones and your emotional and mental balance there. And then whenever you do invest into your self-care to build up your mental, emotional well-being, you know, try your best to stick to it, and don't discard yourself in that manner. In regards to like processing grief and walking through that, you know, it's okay to, you know, really kind of take some time away. There's a lot of judgment around how much time you should take away to grieve. So inviting people to provide food for you, inviting people to just hold space, but also joining a support group such as Mom's Group, where it's not a therapist or a provider that's trying to fix you, but where you can look and listen to other people, decide when to speak, and then, you know, be open to just some shared wisdom. So I do think that processing grief and stress through a Mom's Group or a support group is actually very helpful, and especially virtually, if you can cut off your camera if you're uncomfortable and then turn it on when you are.
Yes, you're absolutely right. There's a lot of specific resources out there, and we all are dealing with grief on various levels. I keep speaking to the women and girls, especially when it comes to not only the grief from the pandemic, but also some of the emotional and trauma that we are experiencing every time we cut on the television. Dr. Carter, one of our attendees asked, is this specific to, let's see, she says, we see the ongoing data for positive cases and hospitalizations for deaths for all people, but do we have specific data for the pregnant women relative to hospitalization, fatality, and infant demise?
Yes, we do. And I'm going to share my screen really quick to share it with you. All right. Are you able to see my screen okay?
Yes.
Okay, so I'm going to show you some US data, and I'm going to show you some Barnes specific data. So this is from a CDC report that was generated from kind of like last fall. And you can see ICU admissions, and what's in red is showing you the risk. And this is based on pregnant patients versus non-pregnant patients. And so this is showing you that the risk of ICU admission is increased 3 times. The risk of needing a machine to breathe for you increased 3 times. ECMO, and that's kind of like a heart lung machine that's helping you to like essentially your body to function because it's in shutdown. And we've had a few patients at Barnes who've been pregnant and required this. It's scary. The increased risk of 2.4 times, and risk of death is almost twice the risk. So this is kind of like the national data that we have available. We also looked at this within Barnes to see, is pregnancy a risk for having severe disease? So, you know, some people escape with like mild symptoms and some people are super sick. And we looked at this in two different ways. There's different scales that you can use. One is by the World Health Organization. This is another one. And when we looked at patients who ended up with severe disease, pregnant patients were almost 4 times more likely by this criteria and almost 5 times more likely by this criteria to end up with severe disease. So even here at home, we have pretty good data that, that it's more severe in pregnancy. And the last thing I'll say about this is a really nice study from the University of California at San Francisco. So you have COVID, you recover, hopefully it's all good and done. They looked at people who had symptoms and they followed them out over time. And so you look, you know, 1 week after you had it, all the way out to 8 weeks after you have it. This is not a one and done thing for everybody. So 25% of pregnant women who had symptoms with COVID 8 weeks out still had symptoms, and they're not mild symptoms, right? So 10% had headache, 8% were short of breath, 8% still couldn't like taste their food or smell things. So it's not like it's a mild infection that, you know, it's not a big deal. 25% of pregnant patients are still suffering with these symptoms afterwards. And just briefly, you didn't ask about this, but I'll show this as well. With COVID, there's also a higher risk of preterm birth for the baby, a higher risk of NICU admission. So both of those are increased threefold. Stillbirth, I'm not really sure. There've been some studies saying a higher risk of stillbirth, some not. So the verdict is out on that, but it's also, you know, like, let's not also forget the impact on the fetus.
Tracy, I know you're saying wonderful things, but you're on mute.
Okay, thank you so much. I just want to say that there are so many questions that we can continue to ask. For the sake of time, I know we need to wrap up because we value everyone's time, but we also want you all to realize that this is a continuing conversation that we have to have over and over again to get that information out there. So of course, if you had an opportunity, you could chat with the group, but we can reach them. We call them Women in the Neighborhood. This is how we win. You can reach out to every resource. There was one other thing that I want you all to realize, and that is these resources are also online. So please, please, we can't express the value of knowledge when you share. So share the information from Prepare STL, the Regional Response Team, Generate Health, the On Your Now show. I gotta plug that. I'm always online through Facebook because there's positivity out here, and we have to make sure that we get that information out. So if you guys have any other questions, we'll be wrapping up. Kelly said, the need is so great of all of you empowering women to provide more information to the STL women. So it can go. This is where we sow seeds and it goes out, out, out. The one thing that I say for sure is you have to be a sister to yourself first before you could be a keeper to everyone else. So we thank everyone for participating. We're looking forward to the next series. Stay connected, and this is how we all grow. Thank you.